Hi there. I'll be talking today about eyelid surgeries. Now, there are various terms used to denote what happens and as we age. But basically, what happens as we age, the eyes kind of droop and the fat kind of bulges out. The upper eyelid and the lower eyelid do have some fat around them even before, but as we age, it tends to come out. If you were to think of the socket of the skull, where the eyeball is there, that is like ball and socket. So it's the kind of the eyelid rotates in that skull, and there's little fat all around so that it can rotate. Pretty much as if you were to have a little ball of eye here, like a small tennis ball here, and to rotate it so that it doesn't get stuck, you need a little lubricant, and that lubricant is the fat. So there's fat all around the eyeball, and it is held in place so it does not come out with something called an orbital septum. Now, as we age, and sometimes for younger people, that septum becomes weak, and the fat kind of comes out of that and comes to the different parts of the lower eyelid and the upper eyelid. In the lower eyelid, it comes out as three different fat pockets. One is the lateral, the middle, and the medial. So one, two, and three. In the upper eyelid, it comes out as two pockets. One is medial, and the other is middle, right here, central. This outer part on the upper eyelid is occupied by the lacrimal gland, the tear gland. So two fat pockets here and three here. Along with that, what happens is that the muscle that is all around the eye, which is again this muscle, orbicularis muscle, that kind of becomes a little weak, and that also causes a few different structural changes. The next thing that happens is this fat pocket here, this tends to droop down, and this fat pocket stays up, and the lid cheek junction, the junction between the lid and the cheek, that becomes more prominent, and it shows up as what we call as a tear trough. Now, so with age, sometimes even earlier on, things that happen: tear trough, the muscle getting weak, the fat pockets coming up, and also sometimes a little droop. The muscle that lifts up the eyelid, that becomes weak or becomes detached from where it is inserted. So the eye can have a little droop. Sometimes one eye has more than the other. There can be fat pockets coming. There can be a tear trough, and there'll be some wrinkles here and some wrinkles on the sides, the crow's feet, and so on. So, in trying to make the eyes look again youthful and nice, as well as having a full field of vision, all these can be modified. The first thing let me talk about is ptosis or droop of the eyelid, which can be with age or it can be present from birth. The muscle that is pulling the eyelid up can be tightened up, it can be reinserted, or it can be shortened so that the eyelids remain open. That is, there are different techniques of doing it, and depending on the degree of the problem and the age of the individual, we modify the techniques and use what's required to equalize the two eyes and to keep them open. The second thing is this loose skin that comes with age right here. And sometimes a lot of older people have to do this, lift their brows up to be able to open their eyes fully and keep their full field of vision. For taking care of that, we do what's called an upper blepharoplasty, removing of the skin, a small strip of the muscle, and tightening the muscle that lifts the eye. That is called an upper blepharoplasty. Along with that, if there are fat pockets that are showing up, we remove a small amount of fat as well. The upper eyelid, once it is lifted up, people feel more alert, more awake, and some people often say that they feel as if a weight literally has been lifted off their eyelids. The second thing that we do very commonly is the lower eyelid lift, and that is a little more tricky. The first thing one has to see is that the lower eyelid does not have retraction. It's not retracted like this, and there is some support down below. One has to assess the fat pockets, and Then one has to see the tone of the eye, that there is no dry eyes. You make sure that there is good snap test. You snap it and it goes right back. So a good snap test, good tone of the eyelids really helps, as well as a positive vector, which means that there is support here in the cheek for the eyelid. The reason why these are important is if we have some negative vector, if we have some problems with the elasticity of the eyelid, then one can have a retraction like this after the operation. Now, some degree of it for a short duration is acceptable, but long term it can be a problem. So once we've assessed the eyelid, then we can go ahead and do what we call a lower blepharoplasty. Lower blepharoplasty would mean removing fat pockets. We do so conservatively, lifting the eyelid up a little bit so that the muscles can be inserted back onto the bone, so that you have a little lift to on the outer edge. And also we improve the tear trough. Now the tear trough is improved either by just dissection, opening it up. This is called the arcus marginalis, and you lift it up at the level of the orbital septum, the one that contains the fat. So you lift that up and let this arcus marginalis improve. Then you lift up the corner of the eye, and you have a fairly good result. The other thing you can do is put fat right where the depression is, the tear trough is. Now, sometimes you may need to do what we call a canthopexy when the eyelid, there is some retraction or the eyelid tone is not good. And what canthopexy means is that you tighten the corner of the eye right here. Now, that can all be combined, or sometimes canthopexy may be required without the lower eyelid blepharoplasty, if there, just for retraction, if the eyelid looks like this, to lift it up and put it back in place. So that is upper eyelid blepharoplasty, lower eyelid blepharoplasty, ptosis repair, and and the next one would be just putting fat or filler in the tear trough to make it look more aesthetic. The lid cheek junction needs to be smoother, so you kind of fill this up, and that makes the entire thing much smoother. That is a non-surgical procedure, but with that you have to be careful because there are lots of little veins that go from this area into the eye, and the injections for fat or for fillers have to be done very carefully in these areas for that reason. But done well, you can have a very good result and a very smooth transition between the eyelid and the cheek. So as far as the eyelids go, these are the common procedures. Sometimes we have to do some other procedures for reconstruction. Some part of the eyelid is damaged, or if there is the eyelashes are going in. We do other different procedures to make it more comfortable for the individual and do a proper reconstruction to shape up the eyelids. However, most common procedures are upper and lower blepharoplasty, a ptosis, which means a repair of the droop, and also fillers. Those are the most common procedures. And add to that Botox for crow's feet, and those would give you the entire spectrum of procedures that we commonly do for the eyelids, for making them look nicer and younger and more relaxed. Now, this is what I had to say about common cosmetic procedures for eyelids. If you have any questions, concerns, or queries, please call us or write to us on the numbers and the address given below. All the best.